My name is Dr. Peter Grossman. I'm a plastic and reconstructive surgeon, and my practice is divided amongst what most people associate plastic surgery with. I do a fair amount of cosmetic surgery, but the great majority of my practice is related to the burn injured patient, both taking care of patients who are acutely injured as well as dealing with reconstructive surgery. It leaves a better wound bed, which is a better outcome for the patient.
Right.
And it's physician friendly because it's easier and faster to use. And I say this sometimes and people kind of laugh at me when I say this, but it makes operating fun. It goes by smoothly and quickly, and you're just amazed at how easy it was to remove that tissue and how nice the wound bed looks when you have removed that tissue. And if you didn't do it enough, you can do it again. It has an adjusting dial on it that can allow us to go from 5 thousandths of an inch to 45 thousandths of an inch. And so if you need just a very thin superficial removal of tissue, you can do it that way. If you need a full thickness removal, you can do it that way. Why is that important? Well, sometimes for partial thickness wounds, our tools have only been either what's called a Versajet, which is a water pick-like instrument to remove dead tissue with hydrostatic pressure, or a high-speed dermabrader where you're actually sanding the tissue down. In superficial burns, you want to get the unhealthy tissue off and get rid of the inflammatory process, but you want to keep any residual dermis that has the regenerative cells in it. When you take a Weck or Watson, even a very narrow guard, oftentimes you'll cut away that residual tissue that has the regenerative cells in it, and you are committing yourself to using the patient's autograft. With the amalgatome, you can get deeper but smoother than you can with a dermabrader or with a Versajet, and yet still leave enough residual dermis so that the regenerative cells are still intact. So then you could then put on a biological skin substitute, create an environment in which the body can heal itself, and get an excellent result without having to harvest an autograft. So there's such benefits that you can do. It has changed my practice enormously in the last 3 years or so since I've been using it. And I couldn't recommend an instrument more, nor can I think of a technological device in burn surgery that is more advantageous for the burn surgeon than the amalgatome. It is my strong feeling that within a very short period of time, the technology of the amalgatome will be the absolute standard of care in burn surgery.